Hello and welcome to 72 Dragons. Today we had the pleasure of speaking with Gail A. Brooks. Gail A. Brooks is an inspiring health equity consultant thriving at the convergence of culture, communication, and community. A Yale graduate with over 15 years of experience, she navigates the complex terrain of innovation, culture, and global pandemics, employing a blend of passionate curiosity and systems thinking. Known for her integrated strategic expertise across diverse realms such as traditional and digital media, experiential marketing, and brand development, she champions health equity in at-risk communities of color. Her work spans initiatives for consumer brands and impactful public health communications. Welcome to this interview, Gail A. Brooks. It is an honor and a pleasure to have you with us today.
Thank you for having me. I am delighted to be here.
My name is Dr. Pietro Aparicio from 72 Dragons. Thank you for joining us and for sharing your experiences with us. Without any further ado, let's begin. Gail, what sparked your interest in working at the intersection of culture, communication, and community for health equity?
Well, I come from a family of social activists, so community is in my blood, so to speak, on both sides, I would say. I've had an interest in people, culture, cultures actually, and communications, or I guess a better way to say it would be how we connect to and engage with others. Pretty much for as long as I can remember. I'm a poor date, right? Because I'm always watching what's going on around me. But in a previous life, pre-COVID that is, as you mentioned, I was a commercial marketer and advertising executive. And I spent almost 20 years studying the dynamics of culture, communication, and consumer behavior. I worked on some, as you mentioned, social impact campaigns like the Truth Anti-Tobacco campaign. I worked with the Gates Foundation on maternal health and infant and young child feeding, but largely for consumer goods. And as you may know, they are very heavily funded and subsidized in the corporate sector. So I really had at my disposal a lot of tools and methods to study culture and culture dynamics, and was able to really leverage the principles of not only cultural dynamics, but storytelling and neuroscience to really drive brand connection, right? Culture is everything. It shapes who we are, how we communicate, what we believe in, our preferences, I guess most importantly, where we find value, right? So it influences just about everything, everything in terms of how we engage with the world around us. But most importantly, as the pandemic struck, I just left in advertising, my last agency job in 2019 down in Florida, and I was really working on my next adventure. I knew that I wasn't as gratified selling cable television as I was, helping people to live healthier lifestyles. And so I started really kind of thinking, what would my next thing be? Well, all of a sudden, COVID-19 hits. In March, obviously, of 2020, I contracted COVID-19. So very early on, we didn't have tests in Fulton County where I lived when I had it. And long story short, I could go on, this could be the whole interview, but let's just say, interesting circumstances would make it so that I had health insurance, but I didn't have a primary care provider. And as you know, we were kind of being told not to go to the hospital unless you were literally falling over, right? And so I was almost kind of shut out of the system and had to really dig in and leverage my strategic research and planning chops to read, open source studies and figure out kind of what was happening, with my body, but then in the communities as COVID began to ravage communities of color. And so, as that was happening, I was looking around and I was noticing that the communications around COVID, and at that time we didn't even have a vaccine, right, were very generic and didn't account for any of the cultural nuance that I had spent almost the better part of 20 years working on developing. And so I felt honestly called really to kind of put my skill set to use in a way that could help with this pandemic. So I put a team together, I put a deck together, and I started shopping. And as we say in advertising, and as luck would have it, I would say great fortune, Fulton County called me. And I started my first health equity campaign, which was a COVID outreach campaign targeting socially vulnerable communities of color here in Fulton County. And it's been an amazing ride ever since.
Yeah, it really sounds like an amazing ride. Now, in your current position at the Black Cross, could you elaborate on how you bridge the gap between the Black, Indigenous, and people of color in America in social equity, particularly in terms of building trust, access, and better health outcomes within these communities?
Sure. So our focus at the Black Cross is really, I guess if you wanted to streamline it, culturally competent communications and storytelling. And so we engage these socially vulnerable communities relying very heavily on trusted messengers. We kind of break them into groups. We call them advocates, allies, ambassadors, and engaged citizens. And so instead of trying to build a relationship and then teach someone or a community what we might have to share about a particular health equity issue, we focus on getting the most accurate evidence-based information to trusted messengers and teaching them the best way to present that information to their communities. So again, tapping into those, telling my age, 15 plus almost 20 years of experience engaging with consumer markets and being very influential in that regard, we bring those same principles over to health equity. So we profile audiences as whole people. We don't just look at kind of their position on a particular issue. We look at what motivates them, what gets them out of bed at night, what keeps them up, or in the morning, and what keeps them up at night. We train these trusted messengers, as I mentioned, in various topics. What they can be issue-based, disease-based, storytelling-based. We create campaign content itself, a lot of digital and social media content, because as you know, social media is the new town square. And that's where cultural wars are waged. And, unfortunately, when it comes to health communications now, I wouldn't go so far as to say we're in a cultural war, but we do have to be very mindful of cultural polarities, right? And then finally, we really, we facilitate conversations and we elevate stories through community-based narratives and storytelling.
Wonderful. So talking about communication in film is a way of communication. Can you talk about the production? So you did your own COVID research, but did you pop your filter bubble? Inspired the focus on the concept of filter bubbles and its relevance in the context of researching COVID-19 related information. And can you share any particular feedback you have received from viewers and at the American Public Health Association annual meeting 2023 in Atlanta, Georgia?
Sure. So I guess I'll break that into parts for my benefit.
Sure.
So in terms of the filter bubble, that is a topic about which I'm very passionate. I have been involved in digital communications for quite some time. I actually did online marketing and communications back in 2000 in the infancy when we still had chat rooms and message boards. And so I have been, I guess, I am somewhat of a digital native, so it's always kind of very front and top of mind. Well, what we know is that with communities of color in particular, social media is, and largely because of the word of mouth nature of social media, is a critical channel of communication for these audiences, right? And so I knew I needed to focus very heavily there. That's where my audience is. But unfortunately, the era of personalization, which was hallmarked as kind of one of the greatest innovations in advertising within the last 5 to 10 years, has really become one of the greatest double-edged swords in communications and media. And so the filter bubble really talks about how algorithms that power social media platforms prioritize some content over other content, right? It is about really delivering information or content to the viewer or the audience that is most likely to be of interest to them, right? And so as we engage with content in social media, these algorithms are keeping track with all of our clicks, all of our shares, all of our likes, as well as the clicks, shares, and likes of our social network. And so what happens is we get trapped, right, in kind of a sea of content that is similar to the content that we've engaged with already. So during the pandemic, we had so many, as we call them, bad actors, people who were, spreading misinformation or disinformation, intentionally spreading incorrect information. And so we needed a way to kind of educate people about doing or finding correct information, because so many of these bad actors were saying, do your own research, do your own research. Mind you, they kind of slid in their own links, right, at the same time and said, do your own research, but we can save you time. Here, click on this one. But they didn't let people know how to do their own research. They didn't talk about media literacy tools such as lateral reading or reverse image searching, or just ways to verify the information on the internet. So I just wanted to create something that was a little lighter because it was so heavy. Everything was so heavy at the time. So animation is a good way to do that. And something that was very simple and that could plainly educate people on the dynamics of social media and, how they come across the information that they find.
Great. I think it's as you said, it's very easy through animation. You guys did a great job in English and Spanish. So what lessons have you learned from your experience in directing influencer ethnographies and documentaries that have shaped your approach to cultural strategy?
Oh, gosh, so many. I would say one of the more important lessons, and I have to credit Morehouse School of Medicine very much in this regard, because I've kind of been immersed in their way, so to speak. But any and all interventions must be community-based and participatory. So that's lesson number one, right? The community must define what success looks like, what health looks like. We can't go into a community and say, oh, this rate needs to go up, that rate needs to go down, when in fact, perhaps, clean water is the most immediate need, right? Community members are also the gatekeepers of the truth and true change, as I like to say, right? So they really hold the true insight into the barriers, whether they be historical, which was a huge issue, right? And that continues to impede our ability to engage audiences, kind of the abuses or the mistrust that has kind of accumulated from past grievances, or whether it be systemic or structural barriers, policies, right, that impede our ability to access the social determinants of health, cultural and community-based barriers, so stories that we tell ourselves or that we tell within communities that kind of perpetuate things that might be barriers to better health outcomes. And then I guess the second thing would be the importance of cultural equity, and meaning that and I probably have said this 2 or 3 times before, because we are literally built on this principle. You can't just show up and expect engagement, right? Influence is about relationship. And so it really requires that we identify the trusted messengers for these communities, and really engage them to facilitate whatever it is that we are looking to accomplish. So for us, by us.
Thank you. Yeah. So community members play an important role in getting the message. Gail A. Brooks, thank you for your time and for sharing this amazing and very valuable work that you do. Thank you very much.
Well, I am super humbled and grateful to be here. Thank you for having me, and I hope that I have added value to the conversation.
Oh, you definitely did.
Okay.